So, good morning, everyone. My name is Shazia Khan, and today's module that we'll be doing the session for the unit is effective communication in health and social care. And we will be looking at learning outcome 1 today, which is to understand the communication approaches used in health and social care and why it's so important to identify communication in health and social care. So this is the start of a new module. Okay, so you've got 4 learning outcomes. You've got learning outcome 1. Tomorrow is learning outcome 2. Next week, learning outcome 3 on Saturday. And then on the Sunday is the assignment discussion. Okay, so you've only got 3 learning outcomes and 1 assignment discussion. So when we look at effective communication, firstly, we're going to look at what the indicative content on today's session is. So we'll be looking at the reasons for communication in health and social care. For example, how people exchange information, their views, expression of needs and wants, social integration. We're going to be looking at the importance of effective communication in health and social care, inclusion, respect, empowerment, self-esteem, choice, expression and guidance and interaction with each other. Because communication is really important within any sort of sector, but we're going to concentrate more on the health and social sector. Key terminology. What are the reasons for communication? Health and social care involve providing care for individuals in any role where people work with others. Communication will be important in health and social cares. You will be communicating with individuals who are being provided with health and social care services. So maybe, things like if you're talking to a physiotherapist about someone who's fallen and they've hurt their knee or their leg, you need to communicate with them to get information how this person's going to get on at home, any sort of resources or anything that person's going to need. Families, carers and advocates of individuals. Why would you communicate with families, carers and advocates? Why do you think you need to communicate with families?
I think because they know them better than we do.
Yes, they know them better than you. And also, if you're talking about any sort of, extra care for the individual, then the families are the ones that are going to be at home and the carers and the advocates to look after this person. So you need to make sure that they understand what they're doing in case, they've got any sort of facilities that have been installed in their house, like a hoist or anything like that. So you need to be able to make sure that you communicate with the person that's the carer. Colleagues who you work with to provide care. So maybe an employer that needs to do readjustments. For example, if someone's got a poorly back, to readjust the chairs, if they work in IT or anything like that. So, you should have some links with the employers as well. Professionals from other care providers, services and agencies also involved in the care of the individuals. What is the main reason why people communicate? So there are different reasons why people communicate, several reasons why they communicate. But the main thing is motivation so that they can convey messages to each other. More specifically, the reason for communication can include things like, like we've said, to express needs, wants, preferences, ideas and feelings, to obtain information, to give information, to interact socially, to express oneself as well, and to show that you care. So you provide empathy and compassion, and to instruct the person is really important as well. It's really important to identify that although speaking and listening is an integral part of effective communication, it is not the only method. Other methods include things like reading, writing, facial expressions, body language, eye contacts and gestures. So there are different, reasons why people communicate and how people communicate. And I mean, have any of you lot got any reasons why people communicate?
People
And
can communicate in case of an emergency.
yes,
They communicate to know more information and to know how to
yes.
take care and all that. Yeah.
Yeah. So if in case there's an emergency, also in case that, you know, any changes have to be made on medication or anything like that within the health and social care, because, you know, you have to communicate with people. Health and social care should be person-centered. Now, person-centered care means working with individuals as equal partners in planning and developing and monitoring care to make sure their needs are met. Effective communication. Now, having effective communication is really important. And it is the process of exchanging things like ideas, thoughts, opinions, knowledge, and data so that the message is received and understood with clarity and purpose. When we communicate effectively, both the sender and receiver feel satisfied. So, you know, effective communication in any organization, be it the health and social care, be it a business, be it the college, you have to have effective communication. Do you think the organization or, you know, the hospital, wherever, works better if you have effective communication? Do you think it feels, if you have effective communication, that it leaves all the parties involved in that communication feeling like they're satisfied and accomplished? What do you think? Do you think effective communication is important?
Yes, it's very important because at the end you're going to get know what to do. You
Yeah.
know, get more information.
So your message is not misunderstood. It's, you
Yeah.
know, it's you're able to understand what the message is in clarity. So effective communication is important in person-centered care. Health and social care workers need to be able to understand the individual's care needs. They will need to use effective listening techniques and ask appropriate questions. They will need to be able to discuss alternatives for care and treatment with the individual and provide information that will allow individuals to make informed decisions. Like we said, you know, the fact that someone may want to, you know, if there's any sort of information in regards to, you know, them going home and they need facilities at home, you need to be able to understand that. They will need to support individuals to communicate their needs and preferences in relation to their care and encourage them to express their concerns and expectations about the care. So if you're going home, you know, if you need a special bed, you need special, stair lift, these are things that will be discussed with the individual. This will ensure that individuals are empowered in their provision of the health and social care. So we've got a video here which looks at what is effective communication in health and social care, and I'll put that video on for you, okay? Just give me 1 minute. Yeah. You can all see the video, yeah? Can you all see this video? And tell me if you can hear.
Yes.
Okay, tell me, can you hear it as well?
Yes.
Excellent. Okay, so I'll just 1 minute. Just increase this.
Effective communication helps you to build good relationships with the individuals you support, their friends and family, as well as colleagues and outside agencies. Good communication skills will help you to develop effective working relationships. give and receive information about the care and support you deliver, provide emotional support to the people you work with, and carry out an assessment of an individual's care needs. As a care worker, you communicate in a variety of ways. Verbal communication, including the volume, speed, tone and pitch of your voice. Written communication, such as records, messages and giving evidence. Body language, which includes gestures such as arm or hand movements that underline what is being said. Facial expressions, reactions and feelings that support what is being said. Eye contact is key for showing you are listening and engaged in a conversation. Position, how we stand and hold ourselves. For people with specific communication needs, you may also need to use communication aids, such as sign language, recognised and used across the world, with some variations being specific to certain regions. Makaton, which uses signs and symbols, often to aid those with disabilities or impairments. Braille, a system of raised dots that enables people who are blind or visually impaired to read via a variety of skills. You need to know how to keep a conversation going, use listening skills to check understanding, organise a conversation.
Can you all hear this? Because I've getting messages that you can't hear.
Yes.
You can hear. Everyone can hear.
Yes, I can hear.
I got a message from Oyi. Oyi, can you hear?
I've started hearing it now. It's only
Sorry?
I can't hear. I started hearing it now. I can't hear it earlier.
Okay, I'll put it back on then, okay?
And use language that is appropriate to the situation.
Hello, Parkview Care Home. Catherine speaking. How can I help you? Right, no, of course, that's fine. I'll just make a note of that. Right, so just to confirm that Mrs. Evans and her daughter will be arriving today at 3 p.m. Right, of course, that's fine. I've made a note of that. And yes, I'll pass this information on to the afternoon staff and we'll make sure that we have a room all ready for her.
Without all of these skills, conversations and communication can be difficult.
Right, I'm going to start the tea rounds. I'll be back in half an hour.
Amanda, could you take Annie her daily paper as you go into the lounge, please?
Okay.
Thank you.
Here's your paper, Annie.
Oh, that's not my paper, dear. That's Albert's.
Well, I was only doing what I was asked.
This interaction didn't go well. Amanda, the care worker, didn't check which paper to take and was also quite sharp with Annie when she informed her it wasn't the right paper. As an effective care worker, you need to ensure that your communication and listening skills are always positive and demonstrate respect for both the people you support and your colleagues. By not checking the information, this simple task has taken Amanda twice as long because she needs to go back for the correct paper. She has also left Annie feeling slightly upset by her abrupt response, which should never happen.
It was the wrong paper.
Well, all the papers are put on the table for the residents every morning and the person's name is at the top of the paper. Oh, I'm sorry. I guess I should have said. I'll tell you what, I'll go and take this for Annie now as I'm going to the lounge.
Okay.
Here we are, Annie, this morning's paper. I can see from the headlines that there are some things about the royal family in the paper today. I know you enjoy reading about royalty. That should be a good read for you today.
I shall really enjoy that. Thank you, Catherine.
This is an example of Catherine using person-centred communication that values the individual and not just communication in order to complete a task. By mentioning something in the paper that she knows Annie will enjoy, she has made the task of handing her the newspaper a much more positive experience. Catherine's body language was also much more relaxed than Amanda's, the first carer, and this can have an impact when communicating. Body language and facial expression is such an important part of communication, and it should not be overlooked.
Okay. So what could you see from that video? What do you think you identified when you were looking at that video? Do you think you identified good, effective communication and a communication that wasn't effective as well? What do you think?
Yes.
What do you think? Yeah. What do you think it's important to, be able to, communicate effectively through body language, things like, your facial expression, the way you talk, why is that so important, body language?
Yeah, because body language is also a way of communication. So if you
Yeah.
use a negative body language,
Yeah.
you're going to
People
pass
can,
It's a
complete.
sign
yeah,
of
can people,
disrespect, yeah.
yeah, it is. It's a bad sign of
And
disrespect,
rude,
like the
yeah.
yeah, it's
Mm.
very rude. Yeah, the way that lady gave that newspaper was quite rude, wasn't it? So you've got to show that you've got to respect the individual, and also, you've got to be able to understand the individual, especially if the individual is older. Elderly patients tend to need more support. So you, as an individual, need to understand in the health and care profession that people with disabilities or people that are elderly and the young tend to need more care. Communication. So communication is a fundamental aspect of health and social care, as we saw in the video as well. Effective communication ensures that care providers understand the needs, preferences, and concerns of service users, and that service users understand the information and advice they are given. Here are some communication approaches used in the health and social care. So we've got firstly verbal communication, and this is a type of communication where we use spoken and written words to get our messages and information across to the other person. In other words, whenever we use our words to express ourselves, our feelings and our thoughts, we are verbally communicating. So these are some forms of verbal communication. First, if active listening. Why do you think when you're talking to someone within the health and care profession, why do you think active listening is so important?
It's important so that we can understand the process of the care of the person.
Yeah. So you're able to understand them and you're fully concentrating, understanding, responding, and remembering what the other person is saying. It's about understanding their emotions and intentions behind the information. So, if you're listening to a doctor and he's talking to you about a medication a patient needs, you need to be fully concentrating. Why do you need to be fully concentrating on what he's saying?
So you won't make mistake or misuse.
Excellent.
Yeah.
Yeah. So you won't make any mistakes. Do you think that happens?
Yeah, it happens.
Many times.
So people don't listen and they don't concentrate and they give the wrong medication to a patient.
Yeah.
Yeah.
And then that in itself becomes a case in itself, where there's negligence. Okay, open questions. So questions that can't be answered with simple yes or no, they elicit a more detailed response. And paraphrasing and reflecting. So repeating back in one's own words what the person has just said to ensure their understanding. So when you use, for example, jargon that is used in the hospital, would you use that with an individual? Hospital jargon. If you're talking about a medication or you're talking about someone's illnesses and you do that as a nurse or a doctor, and you have your way of talking your own language in a way of the medical language, would you use that to talk to an individual who doesn't understand anything?
No.
No,
No.
no, 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 no. It's
You need
not
to make it
appropriate.
clear to that individual.
Yes.
Yeah.
You need to make sure they understand what the doctor's saying or what is being
Yeah.
told.
Yeah.
Why do you need to make sure that you make them understand?
In order for them to
A
know
sign
what
of
they are doing.
respect.
Oh, sorry.
You also protected their privacy. Then you are supposed to inform them the negative and positive side of it, so that they'll be aware of their care, the way they are being
Yeah.
treated and cared for. They should be
Yeah,
aware.
you have to make them, so they're aware of everything, yeah. Then we go on to, when we've looked at verbal communication, we've got non-verbal communication. And non-verbal communication or body language is the use of gestures, tone of voice, expressions, body posture, and so on to send a message. So we've got firstly body language. Body language is the using body movements or gestures, including facial expressions, to convey information. Why do you think body language is so essential in communication?
It's essential because it easily passes information to the to the residents, because they can see through your
Your
body
gestures.
language. Yeah.
Yeah. They
If-
can see your facial expression. Can they see if you're upset and
yeah,
if you're
they can.
yeah? And what does that make them feel?
If
You know,
it's a negative one, it's going to make them sad, unhappy.
yeah.
And if it's a positive one, they are going to be happy. At times, when
Yeah.
They appreciate a
you
lot.
attend to them, maybe what
They
do,
have
you
what?
can
Sorry,
give
what
them
was that?
thumbs up.
I said they appreciate that a lot.
Yeah, they
At
do.
times you can give them thumbs up, things like that. Yeah.
Why do you think they appreciate it? Is that Boniface? Was that you?
Yes, it is.
Why do you
Adi.
think they? Oh, it was Adi. Sorry, Adi. Why do you think they appreciate it?
Yeah, because your reaction to them is so kind and nice to them, so they can say.
Yeah. And especially if someone's quite upset, Adi, it's very important that you make them feel welcome.
Mm-hmm.
So, it's important that you're able to these non-verbal communications. The next one is touch. So use appropriate touch can be a powerful form of communication, especially in comforting or reassuring someone. So if someone's found out they've got an illness and they're unhappy and they're crying, emotionally, you could, just hug them or put your hand around them. But again, then, what needs to be taken into consideration if you're hugging someone or putting your hand around them? What kind of things need to be taken into consideration? Because
You're
not in every
comforting them, and it's a very good signal.
yeah
Like me, one of my residents, she buzzed, and when I got there, she was crying and said she's just all alone by herself. No one is here with her. I hugged her and told her, I'm here with you if you need me. You
that's
buzz, don't
very
worry.
good. Yeah.
You're not here alone. And she told me that I'm very okay now. And she was happy after the hug and the words of conversation, you understand, to encourage her.
Yeah.
She was very happy.
But sometimes, ATHE, is that a good thing to do in some communities?
Sometimes it is not.
Sometimes not.
No. Sometimes
it
in
might be
certain
harassment
communities,
or something like that. They might think like that. Yeah.
in some communities, so you've got to be really, really careful, because in some communities it's regarded as, like you said, it's the touch thing is not always a good thing. I know in because I'm a Muslim, and I know I know sometimes handshakes are not always a good thing for women, men to give handshakes to women within the community, the Muslim community. So I do know there's different things that, you've got to be really careful, because you've got to take culture and community into account as well. Another form of non-verbal communication is eye contact. So maintaining appropriate eye contact can show that you're engaging and listening. Okay, so if you're talking to someone and you've got eye contact with that person, does that person feel like you are listening to them?
Yeah.
Yes.
Yes,
And if,
meaning you are listening to them and you are with them.
yeah, but what if you're who was that? Was that Ayu?
It's Martina, Tina.
Tina, okay. Tina, what if you're talking to them and you're looking around? Is that good? Is that you're listening and engaging with them?
No, meaning you are listening at the same time. You are when your mind is not really concentrating.
You're not paying attention.
Yeah, and that's really important, you know, because if someone's in the health and care profession, like you said, is it ATHE that you had that lady, the old woman who needed that hug, you know, if you wasn't listening and you wasn't engaging, you wouldn't know that she's upset, you know. Sorry.
No, if you are not listening and engaging with them, you do not know if they are upset, what is in their mind, what they have to, what if they need something, you will not be able to understand them.
Yeah, because sometimes, you know, they'll miss their family, you know, they won't understand why they're in hospital, you know, elderly people, you know, if they've got dementia, Alzheimer's, they don't understand what they're doing here. And if you give that little bit of comfort and that little bit of reassurance, you know, and make them feel, you know, that you are listening and engaging with them, they feel more comfort. So it's really, really important that you as an individual provide that comfort, provide that empathy, you know, it doesn't cost you anything, does it really? It's just you providing that comfort and being able to listen, because, you know, I will say there has been instances in care homes where, you know, they have care workers working there and abusing the elderly. There has been instances in the paper, you know, where there has been abuse of power, where the nurses and the care workers are not looking after the elderly, and you know, there's been instances where they've hit them. In the UK, there've been instances where they've left them with, you know, if they've been in a nappy, left them wet for days. You know, and then family members have become, you know, quite concerned and installed cameras and things like that to catch the person out. So, you know, there are instances where things like that happen. So there's not always, you know, the perfect thing, like you said, you know, that it may be that some people, you know, have issues with working with elderly people. And not comforting and not reassuring to that person. Then we've got written communication. So we've got care plans that need to be put in place. So they are written plans that outline a person's care needs and how they will meet them. Why do you think it's so important to have care plans in progress?
In order to be able to know their history, how they've been doing in the past few years.
And you know, medication will be there as well.
Yeah,
you know,
if you it has to do with
if you put a care plan together, you're identifying what their needs are and how you can meet them. Also, written form of communication is medical records. So this is written documentation of a patient's health history and care, and you should know that as a healthcare professional. It's very important you know their medical records, because you need to identify if they have any allergies to medication, if they are able to have the medication, or if there are any other issues around that. So you need to identify that. And then information leaflets, written materials that provide service users with information about their health, treatments, or care services. Why is it so important to give information leaflets to individuals? So if a person has come up and come to the hospital and has been in for maybe diabetes, why is it good to give them information about diabetes?
It's good to give them so that they will know the control, the effects, the everything, how to manage it and all.
Yes, excellent. And how to, you know, what kind of foods, you know, nutritionist, you know, how to manage it, you know, what treatments are there. So these kind of information is really good for individuals, because sometimes individuals don't want to be told by doctors and nurses. They'd rather read up about it and, you know, see if they can come up with, you know, any sort of information about the health conditions and things. So every individual is different. So technological communication. So this is electronic health records, EHRs, digital versions of patients' records. And that's what it's going all towards now. We're having more of a digital system now rather than paper system. Telemedicine, the use of telecommunication technology to provide clinical health from a distance. Text or email reminders, and these are for appointments, medication or checkups. And I find this quite good actually, because if I forget that I've got a doctor's appointment, if I get a text message, then I know I've got it. So it's a reminder. So it's quite good. I mean, I don't know how a lot of you feel about this text or email reminders, but I think it's a good thing that they've got introduced.
Yeah, me too, because if not, I'll forget.
Yeah, you forget. I forget as well. I think mine's old age, but I forget, honestly. So it's good that you've got these, you know, text messages coming through. Visual and oral communication. And this is sign language, a language which uses manual communication to convey meaning. Why do you think sign language is so important? And who is it important for?
It's important because of those that can't hear.
Yeah.
Yeah, it is true that sign language, you'll be able to convey the information to them.
Yes. Yeah. So it's a way of conveying information and meaning to the individual. Pictures and symbols used especially in care settings for people with communication difficulties or learning difficulties. So it's very good to have in place pictures and symbols for people with learning difficulties and people that, you know, have difficulty communicating. Hearing aids, so these are devices that amplify sound for individuals with hearing impairments. So all this needs to be put in place. Why do you think we need all this visual and oral communication to be put in place? Do we have all the same people coming to see us in the health and care profession? Or do we have people that have learning disabilities? And do we have people that, you know, can't hear? Or do we have people that are blind?
Yeah, we do have
So we have a different variety of people, don't we? So we've got to cater for all these people, and these are the resources that are available for them and for them to communicate to us or us to communicate to them. Person-centered communication. Now, person-centered communication is supported by good provider-patient communication that ensures patients' needs and wants are understood and addressed, and that patients understand and participate in their own care. This approach is in the care industry has been shown to improve patients' health and care. And this is where an individual recognizes their own person, them as a person, responds to their individual's preferences and their needs. So it's important that you, as a person, you know, are using person-centered communication within the care profession. Person-centered communication, so empathy, trying to understand and be sensitive to the feelings, thoughts, and experiences of others. Why do you need empathy? Why do you think it's so important within the health and care profession? Why do you think it's important to try and understand and be sensitive to an individual's feelings?
I think
In order
it
for
makes
you
them to be important. They feel important. They will be able to communicate very well since you allow them to participate.
So, yeah, but why do you think do you think that person, you know, is if the person comes and the person, you know, tells you they've got cancer, why do you think it's so important that you provide empathy to that person, are sensitive to their feelings?
Make him or her feels good at first, and let he or she understand this. There's always a solution to things like that.
Excellent. Yeah, try to make them, you know, maybe put yourself in their position and look, be sensitive to their feelings, what they are thinking, and, you know, the experience is really important. You need to empathize with the person, you know, try to reassure them, you know, that there are things in place that will help them, even though sometimes they're not. But, you know, your reassurance and empathy is one thing that's really important in a person-centered approach. Validation, so acknowledging and accepting the feelings and thoughts of others. So if you've got someone who's sat there crying and you just walk away, that's not acknowledging and accepting the feelings. You sit there and you listen to them. You know, sometimes listening is a really good thing, just to sit there and listen to someone. Somebody doesn't need money off you, somebody doesn't need materialistic things, they just need you to listen. And listening is so important, you know, and being empathetic if someone is going through something like that. I mean, I don't know, in your experiences, have you lot had people where you've had to just listen to them and in your health and care profession and just understand what they are feeling?
Yes.
Any examples anyone got where they've had patients where they've just had to, you know, be empathetic towards and accepting their feelings and thoughts?
Yes, I've had that experience number of time, and most of the time it's always with the dementias. At times they don't know why they are not in their home. They miss their family. They think they are isolated. They are alone and all that. You understand? You have to, you know, try to encourage them. You have to try to make them understand why they are there.
It's really sad when you have people with dementia. Because it's one of the things that, you know, and I always say that if you listen and you empathize and, you know, understand people's feelings, you're a good person, because we may be in that position one day. I always think like that, you know. So, you know, you as an individual need to be more, you know, you need to provide empathy, and you need to be more sensitive. You need to be able to listen, you know, it's really important. The next person-centered communication is choice. So allowing service users to make decisions about their care. So, you know, sometimes people want to make their own decisions, you know, and some individuals are quite stubborn that they don't want to, you know, take certain medication. You should be able to understand this. Communication passports. So for individuals with severe communication difficulties, these are documents that provide essential information about them, like how they express pain or what they like and dislike. Group communication, these are therapy groups. These might be for people with similar conditions or challenges to share their experiences and coping strategies. Why do you think therapy groups are important? Do you think they're important to have?
You mean a therapy group?
Yeah.
Yeah, with the therapy, they'll be able to, you know, it's also a way of care, you know, care and treating them.
And other people will be there, won't they? So they'll be sharing their experiences.
Yes.
So it's really important, you know.
They communicate,
Yeah, so you might think that, you know, there's people, you might think that there's nobody there in the same position as you, but, you know, there is always people there in that same position. And, you know, sometimes it's, you know, they understand you more as well. So it's a way of understanding people. Team meetings where health and care professionals come together to discuss care plans and coordinate care for individuals. Cultural sensitivity and awareness. And we talked a little bit about this, important. Why do you think cultural sensitivity is important?
Yes, I think it's important because we all have different cultural background, and for one to be able to deal with a client, you must understand their cultural background and respect the cultural background.
Yeah, we all have different cultures. We should be respecting each other's cultures and communication styles, beliefs and values. So cultural sensitivity and awareness is understanding and respecting cultural differences in communication styles, beliefs and values. This includes being aware of potential barriers to communication, and finding ways to overcome these barriers. So it might be language barriers, it may be cultural barriers, it may be physical barriers. Confidentiality, so that's ensuring that information about service users is kept confidential and only shared with those who need to know. Feedback, encouraging service users to provide feedback on their care and using this feedback to improve the services. Effective communication is essential in building trust, fostering understanding and ensuring that the needs of service users are met. Care professionals must be adaptable, using different forms of communication to meet the unique needs of each individual. So not every person is the same and they need different forms of communication. 1.1, explain the importance of effective communication in the health and social care profession. Effective communication is crucial in the health and care profession for a multitude of reasons. Here's an explanation of its importance. It promotes person-centered care. Okay, so effective communication ensures that care is tailored to the individual's needs and preferences and values. So it's important that you take into account the person's needs and their preferences and values. It enables healthcare providers to understand the individual's experiences, concerns and desires, ensuring that they receive care that aligns with their personal goals. Ensure safety, so clear communication between healthcare professions can prevent mistakes. Misunderstandings or lack of information can lead errors in medication, like we said, treatment plans or any other aspects. So good communication is really important in health and care profession in case, you make mistakes. And also, if you make a mistake, there's always going to be a case for negligence. You need to make sure that the person you are, looking after is getting the medication on the right time and is getting the right medication. So there's no allergies or anything against that. It builds trust. So when healthcare professionals communicate openly, honestly, and transparently, it helps to build trust with service users. This trust is fundamental to a therapeutic relationship and encourages individuals to seek care, share concerns, and follow medical advice. I think trust is really, really important. Why do you think it's so important? Building that trust. Why do you think it's so important to build trust with the individual?
It is very good so that you'll be able to secure their privacy without letting it out. That trust should be there, that you're not going to give out their information. You understand? They should be able to trust you whenever they have any difficulty, that you are not going to let it out. The trust should be there. Very important.
Is it something that, like if you have an individual where you're looking after that individual, they are able to trust you about talking about any sort of concerns, or, will talk to you openly and transparently, without, being scared to talk to you. So you build that trust. Yes. It's very important to build that trust. And supports decision making. So service users need accurate and comprehensive information to make informed decisions about their care. Effective communication ensures they understand their options, potential risks and benefits. Enhancing team collaboration. Health and social care often involve a multidisciplinary approach. Effective communication among their members ensures everyone is on the same page, fostering collaboration and coordinating care. It's also there to support emotional and psychological well-being. So being in a healthcare setting or requiring social care can be stressful and emotionally taxing. Open and empathetic communication can provide comfort, reduce anxiety, and help individuals feel understood and valued. It also promotes health literacy. So proper communication helps ensure that individuals understand their health conditions, the importance of adhering to treatment plans, and how to manage their health. This knowledge empowers them to take an active role in their care. Respects cultural differences, which we looked at a little bit earlier. So health and social care settings are often diverse. Effective communications mean being culturally sensitive, ensuring that care respects and takes into account cultural beliefs, values and practices, and things like, shaking a lady's hand within the Islamic community, sometimes hugging someone may not be something that, you need to bear all this in mind when you're talking to individuals from different cultures. Facilitates informed consent. So before any treatment or intervention, service users must give informed consent. This can only happen when they have effectively communicated with about what the treatment involves and its risks and its benefits. It reduces conflicts. So clear communication can prevent misunderstanding and reduce potential conflicts between service users and providers or among providers themselves. It enhances privacy and confidentiality, which someone mentioned earlier on as well, which is really important. Proper communication protocols ensure that sensitive information is shared only with those who need to know, respecting the privacy and rights of service users. Things like GDPR, you know, the confidentiality laws, the fact that, you know, you can't just give anyone's information to anyone. You need authority to do that. Supports continuity of care. So when there's a need for handover, whether between shifts or between different care settings, effective communication ensures that next set of caretakers has all the information they need to continue providing consistency. I think that's really important. Supports continuity of care. Why do you think that's important? They're all very important in the communication, but I think, you know, when you're working and you're going to hand over and you finish your shift, why is it effective communication so important in that instance?
I think it will help the incoming staff, I mean the new staff, to know the extent of what you have done and the next thing to
yes. Yeah. Yes. So what medication you've given, when the person needs to take the medication again.
Yeah.
This is so important. Or what you've done. Have you taken the blood test? Have you taken the ECG? You know, these kind of things you need to document so that the next person, effective communication is so important in that instance, because you are communicating with that person what you have done so that they can continue in their shift to provide the consistent care that the individual needs. So in summary, effective communication is a cornerstone of quality care in health and social care setting. It impacts every aspect of care, from safety and trust to decision-making and emotional well-being. Without it, the quality of care can be compromised and the well-being services users can be jeopardized. Good communication skills have a positive effect on health outcomes. Patients and those important to them want to know about and participate in their own health and care associated decision making. So all staff need to be able to communicate sensitively and compassionately with each other so that they're able to understand what the individual's needs are. Effective communication between healthcare professionals is also so important, because it should be clear, timely and discreet. This communication is needed to make accurate diagnosis, ensure that treatments are appropriately provided, and to ensure patients understand health status and needs. So it's not just between the individual and the care worker, it's between the profession, the healthcare profession. So it might be the doctor who has to provide an accurate diagnosis and ensure that treatments are given properly, between each other and the nurses. So what we've done now, we've finished the session for Learning Outcome 1 on effective communication skills in healthcare social profession. These are some of the references that I've used. Additional resources are available on Moodle for you to go onto. Any journal articles or any additional videos are available on Moodle. These resources will also be available on Moodle. Again, further ebooks and journals on this are on Moodle for this unit. Further reading that you can look at before next week's session is this one on communicating with people with a learning difficulty. Because why do you think it's more, if we communicate with someone with learning disability, do you think it's a little bit more harder to communicate with that person?
Yes.
If you have someone, yes. Why do you think it's so hard?
Because it's difficult for the person to learn or understand what you're saying. So you have to, make every possible best to make sure you convey the information to them in the way they will understand.
So you could have someone who's, it takes time to, get things into their mind. So you may have to communicate and talk to that person slowly, and you may have to, write things down for the individual. You may have to provide extra services. So it's really important you bear that in mind when communicating with people with learning disabilities, because, you have to spend that extra bit of time with them. And then there's another resource. This resource is by MenCap, communicating with people with learning disability. Then you've got 3 must-have communication skills for health and social care. And that's the link there is to Training Express on communication in health and social care. And then they've got the link there, or email, sorry, if you've got any queries or questions on anything. And when it comes to submitting your assignment and this, you need to have these links. So it's learnerwork@ukvarsity.co.uk, and that will be towards the end of it. So we've only done learning outcome 1 today. Tomorrow is learning outcome 2, then learning outcome 3, and then the assignment discussion. And that's where you need to submit your assignment to. Any questions? Thank you for attending today's session. And thank you.
I have a question, please.
Yes.
Please, yeah, just one.
Yeah.
Are you listening?
Yes. Who's that? Who's speaking?
It's Claude.
Oh, hi, Claude. Yes.
Hi. When I'm doing reference on my last session or last assignment, I'm getting some information on Moodle. On reference, I should write Moodle. This coming from Moodle. Is it possible?
Is it what you use the referencing on Moodle? Yeah.
Okay, that's what I'm asking. Yeah, that's fine.
Yeah, and you need to use the Harvard system of referencing. Okay.
Yeah, this is what I'm doing.
Yeah, the main system for all of UK Varsity is the Harvard system of referencing. So if you're putting something from a book in your main assignment, you need to put the author and the year. Okay. And then if you're putting that same author in the bibliography, you have to put all the details, such as the author, the year, the name of the book, the edition, the place it was published, and the publisher. Only in the main text you need to put the author and the year.
Yeah.
Okay. So you need to use the Harvard system of referencing and go to Moodle for that. That will help you a lot.
Okay, that's fine.
Okay. Any other questions? No? Thank you for attending today's session, and I will see you tomorrow at 9 o'clock for learning outcome 2.
Okay, thank you.
Bye.
Thank
Bye.
you. Thank you, everyone.
Thank you.
Thank you.
Thank you.